It's now my great privilege to introduce our 2009 Convocation guest speaker, Rebecca Onie, the co-founder and chief executive officer of Project Health, a social entrepreneurship program that mobilizes undergraduate volunteers to serve the health needs of over 4,000 underprivileged families. Rebecca co-founded Project Health in 1996 while she was an undergraduate at Harvard College. She went on to receive the Juris Doctor degree from the Harvard Law School in 2003, where she was the editor of the Harvard Law Review and received several other honors, such as the Massachusetts Association of Women Lawyers Scholarship and the Ford Motor Company Leadership Scholarship. She's been named fellows of organizations that recognize leading social entrepreneurs who have innovative solutions to social problems, and she received a Young Alumna Award from the Radcliffe Institute for Advanced Study in 2008. Rebecca was recently honored in a speech by First Lady Michelle Obama, who cited Project Health as the inspiration for President Obama to ask Congress to provide $50 million in seed capital for a social innovation fund. And recently, Project Health was the recipient of a $2 million grant from the Robert Wood Johnson's Foundation. I first met Rebecca when she approached Boston University about having Boston University students involved in Project Health. I was incredibly impressed by her and the work that she has done in such a short time, and I immediately recognized what a wonderful inspiration and role model she would be for our students. And so it's really a pleasure to welcome Rebecca today.
Let me first say congratulations. This is such an exciting day, and a thank you to Dean Waters for inviting me to be part of it. It's an honor, really, to be here. As a freshman in college, I decided that I wanted to be a lawyer, and I apparently had argued a great deal at the dinner table as a child and was informed that as a result, I'd make a fantastic lawyer. So my freshman year of college, I reached out to an attorney, Jeff Purcell, at Greater Boston Legal Services, and secured an internship in the housing unit there. And Jeff was just an amazing attorney, inspired, a little bit crazy, and from the very first day, put me on the front lines. And I would interview clients who came in, many of whom were about to be evicted or who had serious code violations in their apartments. And the stories were just devastating. Families would come in about to be evicted because they hadn't paid their rent. And of course, we would say, why didn't you pay your rent? If you don't pay your rent, you're going to be evicted. And they would say, because I'm paying for my HIV medication, which frankly seemed like the right choice to me. We would have moms who came in, moms after moms who came in where their child had asthma, and every morning would wake up covered in cockroaches, a key asthma trigger. Our litigation strategy was actually to go into their homes and collect the cockroaches and hot glue gun them to a poster board that we would bring to court, and we would always win. Increasingly, though, I was frustrated with this approach. By the time families came to us, came to legal services, things had gone devastatingly wrong. And there just seemed that there had to be a more preventative way for addressing the underlying health issues, because even though they would show up with housing issues, time and time again, the underlying issue was always health. So at the end of my freshman year of college, I read an article in the Boston Globe magazine about Dr. Barry Zuckerman, the chair of pediatrics at what was then Boston City Hospital, now Boston Medical Center. And the article talked about how Dr. Zuckerman had this sort of radical but totally obvious vision that a pediatrics department should be a place where children actually get healthy. And that would require going way beyond traditional clinical care. And he had mobilized a dream team of professionals who would work to achieve this result. Lawyers, social workers, developmental psychologists, caseworkers. And I just thought this was the most brilliant thing ever. So at the start of my sophomore year, I called information, because this was, of course, the pre-Google era, and got Dr. Zuckerman's phone number and decided to call him. And it's one of those classic phone calls where as the phone rings, you're just desperately hoping you go to voicemail because you have no idea what you're going to say. And in fact, it's actually impossible to track down Dr. Zuckerman. He has countless honorary degrees. He's one of the nation's preeminent pediatricians. But as luck would have you, his assistant cheerfully answered the phone and said, "Dr. Zuckerman's right here," and handed the phone to him. Stumbling over my words, having no idea what I was going to say, I congratulated Dr. Zuckerman on his good work. I'm sure he was thinking, "You're 18 years old. Why would I possibly care?" But also told him that I thought there could be an incredibly important role for young people to play in what he was trying to accomplish. And to Dr. Zuckerman's great credit, he took me seriously and said, "Why don't you come spend 6 months in the pediatrics department talking to our physicians, talking to our patients, talking to our healthcare providers, and then you and I will talk." And so I did. So I spent 6 months of my sophomore year of college taking the #1 bus down Mass Ave to BMC, and frankly talking to anyone who would take the time to listen to me. And I had no idea what I was doing. I had never done a needs assessment. I had no public health background. So I would just say to folks, to the doctors and to the nurses, if you had unlimited resources, what would you give your patients? And they would totally laugh at me, right? What a naive question. But then grow serious. And we ended up having an incredibly powerful set of conversations where they would say, "Here's the thing, Rebecca. Every day, I have patients that come into this clinic, and the child has an ear infection or an asthma exacerbation. And I prescribe antibiotics or I prescribe an inhaler. But the real issue is this family's living in a car. There's no food at home." And then they would have two responses. Some would say, "I don't even ask about these issues because I have no idea where to begin. I have patients piling up in the waiting room. I have just a few minutes with each patient. I have no idea where to start." And other folks would say to me, "I take $20 out of my wallet and give it to my patients." And I remember thinking, I don't know anything about the healthcare system, but this is not a system. This is total chaos. Project Health's Family Help Desk program, which is our core program, was born of these conversations. The idea was a simple one. We'd put a desk in the clinic waiting room, staff it with college volunteers, and when patients came into the doctor's office, the physician or nurse had a prescription pad, and they could prescribe food, prescribe housing, prescribe job training, or fuel assistance. And then the family would take the prescription out to the desk in the waiting room, and our core of volunteers would connect those families out to the resources that they needed to be healthy. In 1996, Project Health began with 10 volunteers and a card table that we would lug out of the closet into the waiting room. And today, Project Health has a core of 600 college volunteers in 6 cities who dedicate over 100,000 hours a year to connecting over 15,000 children and adults with the resources that they need to be healthy. Thank you. We are in pediatric outpatient clinics, pediatric emergency rooms, community health centers, newborn nurseries, OBGYN clinics, public health department clinics. Here at BU, thanks to the incredible leadership of Dean Waters and her colleagues, we have been able to recruit an extraordinary group of 31 undergraduates here at BU who speak 15 different languages and currently staff family help desks in the pediatric emergency room at Boston Medical Center and at Upham's Corner Health Center, which serves the neighborhood of Dorchester here in the city, a neighborhood that faces significantly elevated rates of pediatric asthma, HIV, and infant mortality. We engage in this direct service work here in Boston and in our 5 other cities because we believe that can actually lead to systems change. Frankly, we find it outrageous that even though it is well documented in the medical literature that access to basic resources like food, like housing, directly impacts health outcomes, we do not yet have a healthcare system that addresses those needs. In fact, at Boston Medical Center alone, there's 32,000 visits each year to the pediatric emergency room and 2 full-time social workers who are there 9 to 5. Our vision is that every clinic in this country that serves a substantial low-income patient population will routinely and systematically screen those patients for their unmet resource needs and connect them out to the community resources that they do, in fact, need to be healthy. So when I share this story, people always say things like, "That's amazing. How did you do that as a college student?" But here's what they don't understand. The very things that they think were my liabilities, my inexperience, my being an outsider in a highly professionalized system of healthcare, have proven to be the greatest assets for me and for Project Health. And so as you embark on your careers in that infamous post-graduation real world on this momentous day, I urge you to embrace the particular advantages that come with being a newly minted graduate and to capitalize on those advantages as you go on to build your careers. There are 3 key advantages that I'd like to highlight very briefly. First, as someone new or relatively new to the healthcare system, you have the ability to see things that those who have been in that system for a very long time can no longer discern. 13 years ago, when I talked with the physicians and nurses and other healthcare providers at Boston Medical Center, all they could see were the patients. So many patients piling up in the waiting room. But what I could see as a college student was that Boston had an amazing, huge, untapped workforce of 114,000 college students that we could deploy to address the specific needs of those patients and ensure they had the resources that they needed in order to be healthy. Second, often the most compelling strategies to achieve systems change are the simplest and are created by those who are not entrenched in that system. Today, for example, people think that healthcare is messy, it's complicated, it's expensive, it's bureaucratic. But at Project Health, we believe that something as simple as a desk in a waiting room, staffed by a couple of college volunteers, can empower hundreds of doctors to ask questions of those patients that they never would have asked before, and actually begin to create a healthcare system where all of the factors that impact health outcomes are addressed. Clay Christensen, who's a professor at Harvard Business School, calls this phenomenon catalytic innovation. Catalytic innovations are simpler, less costly, less sophisticated, but good enough innovations to perpetually undersolved social problems. A classic example of a catalytic innovation in healthcare are the controversial minute clinics, basic primary care clinics in drugstores or Walmart that make readily available basic care to folks so that they don't have to go through the expense and often the time-consuming process of going to the emergency room or their doctor's office. Importantly, because catalytic innovations are simpler, less expensive, and more broadly accessible than existing solutions, they tend to be created by people who are new to those systems or outside of those systems altogether. And so once again, we see how the newness that you will bring to healthcare delivery will be a powerful advantage for you as you seek to reform that healthcare system and make it stronger. Finally, it's increasingly clear that real change in healthcare, which we so desperately need as a country, demands more than just smart, competent clinicians, although of course that is critical. Last year, actually just a few months ago, the global consulting firm of McKinsey & Company did a study asking the question, what would it actually take to change healthcare in this country? And they interviewed hundreds of clinicians and looked at dozens of case studies. And their key finding was, to change healthcare in this country, we need leadership. That's all of you. What they found was that leadership, the ability to mobilize resources and people around a common vision, was so important, and yet healthcare organizations struggle to develop that leadership on their own. And so once again, we're reminded the advantages of being new to this whole business of healthcare. In short, today you are as ready as you ever will be. In fact, maybe more ready than you ever will be to create the new healthcare system that this country so desperately needs. So go forth, ask the tough questions, demand better answers than we have received, spark innovations, and generally shake things up. We have been waiting for you.